note on pervaginal examination or PV examination. First, the definition. During labor, vaginal examination should always be preceded by abdominal examination. Pervaginal examination is the only certain method of determining the degree of dilatation of cervix. A little bit of information. I have written some words in short form. I hope you get it. Next is the purpose of pervaginal examination. Number 1, to diagnose the onset of labor, true pain, patients with true labor with dilatation, and false pain, patient without association of the dilatation of the cervix. Number 2, in early rupture of membrane to exclude the cord prolapse. In primary cases, 12 to 18 hours of labor. In this, membrane ruptures at 7 to 8 hours. Number 3, to know the position, presentation, degree of molding, descent of fetus, bag of water, and fetal abnormalities. Number 4, to assess the progress of labor. Number 5, to determine the degree of dilatation of cervix. Next comes the indication of the pervaginal examination, and the indications are: number 1, in case of high risk, to monitor cervical dilatation more accurately and to diagnose prolongation of the latent phase. Number 2, when there is doubt regarding presentation. Number 3, in an obese patient to determine whether the head is engaged or not. Number 4, to check whether bulging of membrane is there or not. Number 5, to decide whether the woman is in labor. Number 6, before giving enema to a multiparous woman who is having strong uterine contraction. Number 7, when in doubt as to whether the second stage has begun. Number 8, when prolapse of cord is likely to occur, for example, after the membrane has ruptured in polyhydramnios. Example number 2, after the membrane has ruptured in breech or face presentation. Next, moving on to number 9, in multiple pregnancy if there is doubt regarding the lie of second twin. Number 10, to determine the cause of delay and report such facts as the level of the presenting part, size of the caput, and the degree of molding. The articles required for pervaginal examination are: a bowl with Dettol swabs, sponge holding forceps, lubricants, gloves, torch, and kidney tray. What are the preliminaries for pervaginal examination? First is toileting. The hands and forearms should be washed with soap and running water. A scrubbing brush is used for the fingernails. Number 2, sterile pair of gloves is to be put on. Number 3, vulval toileting. Vulva should be swabbed from up and down with antiseptic lotion. Remember, the vulval toileting is always from upwards to downwards direction. Number 4, gloved middle and index fingers of the right hand, smeared liberally with antiseptic cream, are introduced into the vagina after separating the labia by 2 fingers of the left hand. Number 5, complete examination should be done before fingers are withdrawn. Number 6, vaginal examination should be kept as minimal as possible to avoid risk of infection. Following information are to be noted and recorded carefully. Number 1, degree of cervical dilatation in centimeters. Number 2, degree of effacement of cervix. Number 3, status of membrane and if ruptured, the color of the liquor. Number 4, presenting part and its position by noting the fontanelles, sagittal suture in relation to the quadrants of the pelvis. Number 5, caput or molding of the head. Number 6, station of the head in relation to ischial spine. So that's all for today. I hope you liked my video. Thanks for watching.